Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And movie's gonna make me a big star.
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. Soccer has been on the news quite a bit lately, actually more than the anniversary of the birth of our country, but that's a different video. Soccer has been on the news lately, and I think one of the things I enjoy most about it are the dramatic injuries where players are kicked, brushed up against whatnot, then fall down, grab their knee, and gyrate for a few seconds to grab camera attention, and they go back to playing. But it's a pretty intense 90 minutes of playing, so I can understand why those things happen. I've played soccer a little bit in junior high, just don't have the physique for it, just like America playing against Belgium, found out. And again, my family is from Belgium, Flemish originally, and they obviously produce some very fine soccer players, but my family are all kind of more pear-shaped and wouldn't make it to the soccer field professionally. But so watch soccer with interest, a lot of fun, a lot of energy. It was kind of nice to see the whole thing going on across the world and all the good attention that the United States was receiving as people from Europe and Southern America were coming into the United States for the first time. But it was interesting in the last week, particularly today, I've seen a couple soccer injuries. And even though these people are in phenomenal cardiovascular shape, they can play soccer for 90 minutes, then go out and run 2 miles just to stay in shape. It is pretty hard on the low back and the legs, and particularly the sacroiliac joint. And again, the sacroiliac joint is at the top of the hip, and it is the connection between the spine and the leg. That sacroiliac joint is supposed to move 3 to 5 degrees as people sit, as they go to sit, and then transfer up from a chair. The joint rotates. The joint also rotates when the person goes and kicks or does a long stride. That can sometimes pull the joint hard enough that it shifts out of place. And when it shifts out of place, most of the time it goes right back in, no big deal. But people who are very active in running or very active in kicking can knock that joint out of place, and it stays out of place. And then it becomes chronically painful all the other time. So high performance athletes have that problem, but that's not who I was seeing. People who are not high performance athletes, who are desk jockeys, who spend most of their time seated or driving in a car or doing twisting and sitting, sometimes will push the joint out of place. Women during childbirth, natural childbirth, can also shift the SI joint, the pelvis, out of place. And so those are the people I see most commonly with SI problems. It's postpartum, women who have had natural childbirth, or those who have been sedentary and are sitting for so long that just the force of gravity has pushed their SI joint out of place. And then occasionally the high performance semi-pro athletes who are getting kicking and doing a whole bunch of vigorous activity. But so what's kind of hard for many doctors to treat, and again, I'm a subspecialist, so for me, this is day in, day out. I don't treat thyroid problems. I don't treat diabetes. But I can treat SI joints and back problems because I see them all day long. But what makes the diagnosis hard for most physicians is there's no test to order. It oftentimes doesn't show up on an X-ray, oftentimes does not show up on a CAT scan, doesn't show up on an MRI, sometimes doesn't show up on an EMG, although each one of those tests, taken as a piece of the puzzle, can be useful. What it shows up on is a physical exam, where a doctor will actually go in and twist the hip or twist the SI joint, and that can reproduce the pain. Sometimes just pushing on the joint is enough to reproduce the pain. But it's amazing how painful that joint can be. And there are some scholars in the study, back troubles and hip problems, who think that the discs themselves don't really cause any pain. So again, we've all heard about back pain. People have ruptured discs, and that a ruptured disc pinching a nerve can cause back pain. There are researchers who believe that the pinched nerve can cause leg pain, calf pain, and foot pain. But what really causes the back pain is the SI joint going out of place because the nerve is pinched. So if the pinched nerve is corrected, the SI joint goes back into place. And again, there's reasonable literature out there, reasonable research showing that back pain really is almost all from the SI joint, not the discs. But again, the SI shows the pain because of a disc problem. But it's kind of interesting, and it's been an evolution of technology and understanding of how the back works in the 30 years I've been doing this, because we all assumed originally that the vast majority of back pain was from the disc and only a small portion was from the SI. In the last 30 years, I've seen this reverse. I've seen that research is showing that, again, back pain is coming from the SI joint, although the cause may very well be the disc. So that's something that has brought an awareness to me, particularly as now I'm watching soccer and watching all these high performance athletes jumping, kicking, twisting, and whatnot, and really stressing their SI joints. The difference is they train for this, and they do what we call muscle hardening, work hardening, ligament strengthening, so they can do those kinds of things. But again, in my everyday life practice, I'm seeing SI joints shifting out of place, not because they're kicking a ball at 60 miles an hour. It's because they've been sitting too long and the joints are sagging and the ligaments are sagging and they're going out of place because the tissues have gotten soft. They've lost muscle tone. They've lost ligament tone. And so my job is to educate the patients on proper strengthening for the low back, proper strengthening for these SI ligaments, so that they can become a high performance desk jockey and be able to sit straight without pain and be able to lay on their side at night. Those are the common problems people have. Difficulty in and out of a vehicle, difficulty on and off a toilet, rolling over in bed. That's when the SI joint really starts to cause trouble. Also, certain things like reaching under a table, bending, twisting, that can unlock the SI joint, knock it out of place. And sometimes people are so painful that they can't do the basics. They can't go for a 20-minute walk. And that's walk is necessary for back health as well as hip and SI health. So if they can't do that basic walk, then they start to get back pain from disuse, or they start to develop hip socket pain because the hip is a ball and socket joint. They start to develop a dry hip socket, which can lead to another set of pain. So sometimes I see patients who've been in pain for several years now. So not only do they have the original SI pain, they have a dry hip socket, and they have back pain. And particularly that back pain works its way up to where women's undergarments fit right about this level. And that becomes the most annoying of all the three pains. So one of the things I do then is try to make a list of all the what we call pain generators, things that hurt, and then one at a time work through the list with the ultimate goal of getting a person back to their function. But I would encourage those who are watching, if you've had trouble with your back, read about the SI joint, the sacroiliac joint, the joint that's in the pelvis, the top of the hip bone that connects the spine to the hip socket, because that SI joint is a very important source of pain. And a quick little home way to self-diagnose is see if you can cross your legs. Can you put your left ankle onto your right knee or vice versa? And is that uncomfortable? And if it is, that's a pretty good sign that the SI joint is tight and is a problem. And then you've got to see somebody to figure out whether that's the primary problem or is this a secondary problem, because A hip socket can cause SI problem. A low back can cause SI problem, or of course you can just have eye pain. The basic treatment for it is stretching, anti-inflammatories. Prescription ones usually work best, such as meloxicam or Celebrex, but ibuprofen or Aleve also works. Icing, sometimes a lightweight brace around the SI joint, known as an SI belt, can be helpful. And if all that doesn't work, that's when you see someone like me and injections can be given and other odds and ends. I've hoped you've enjoyed this show. Hope you've learned something. If so, please like, please share, and please subscribe. You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star? 'Cause I can play the part.